Herpetic keratitis is an infection of the cornea, the transparent front part of the eye, caused by the herpes simplex virus. While the herpes simplex virus that affects the genitals is type 2, the type that affects the eyes and mouth is type 1. This infection may affect the different layers of the cornea and cause an inflammatory reaction. It may also affect the most profound structures of the eye like the iris and cause inflammation inside the eye. The cause of herpetic keratitis may also be the herpes zoster virus, commonly known as shingles. The symptoms, affectations, and treatment are different to herpetic simplex keratitis. Symptoms. The symptoms of an initial eye infection caused by the herpes simplex virus are caused by conjunctivitis, which may pass for conjunctivitis caused by any other virus. Red eye, watering eyes, discomfort, and stinging are the main symptoms. When the virus infects the cornea for the first time, it generally affects the epithelium, the most external layer. Pain, red eye, discomfort caused by light, watering eyes, and blurred vision are the most common manifestations. When the virus reactivates, it can once again infect the epithelium or the most profound layers of the cornea like the stroma, the thickest layer of the cornea, or the endothelium, the innermost layer of the cornea. In addition, it may cause an inflammatory reaction in the corneal stroma or inside the eye itself. The main symptoms of this affection are a loss of vision, pain, red eye, and discomfort caused by light. Causes and risk factors. The herpes simplex virus is transmitted through mucosa to mucosa contact or by secretions from infected mucosas, like mouth to mouth or saliva or tears containing the virus coming into contact with to the eye. Once the virus infects the eye, it can never be eliminated. When the manifestations or symptoms of keratitis disappear, the virus remains dormant in the nervous system of the eye. When the virus activates, the keratitis recurs. There are different hypotheses on the factors that may awaken the dormant virus and cause recurrent keratitis. Exposure to the sun, stress, or a low immunity system are just a few of these, although studies have not been able to confirm this. The types of herpetic keratitis depend on the layer of the cornea affected and if the keratitis is caused mainly by a direct infection of the virus or by an inflammatory reaction caused by the virus. Epithelial keratitis. The virus invades the corneal epithelium causing linear lesions with branches called dendritics. If not treated, these lesions widen and grow to look like maps called geographic lesions. The longer it takes to treat and cure, the more scarring is left, causing a permanent loss of vision especially if the center of the cornea is affected. Immune stromal keratitis. It appears if the patient has already suffered an episode of epithelial keratitis and the virus has become dormant. This type of keratitis is due to inflammation caused by particles of the virus inside the stromal layer of the cornea. There is no active virus. The cornea becomes edematized or swollen, causing a lack of vision. The corneal epithelium remains intact. Stromal necrotic keratitis. It appears if the patient has already suffered an episode of epithelial keratitis and the virus has become dormant. This type of keratitis affects the corneal stroma, but unlike the type above, stromal necrotic keratitis is caused by a reactivation and a direct invasion of the virus inside the cornea. In addition, it usually causes more virulent inflammation of the cornea and the symptoms are more severe. The cornea becomes edematized but an invasion of white blood cells also appears in that area, making it look similar to a corneal infection caused by other germs such as bacteria or fungus. It is very important to rule out these causes of infection by getting a culture of the corneal sample affected. Endotheliitis. It is a direct infection of the virus with secondary inflammation in the most profound layer of the cornea, the endothelium. In addition, it causes an inflammatory lesion inside the eye. The cornea becomes edematized. There are white blood cells adhering to the endothelium and floating inside the aqueous humor, the liquid found inside the eye. Herpetic keratitis. Herpes keratitis of the eye. Herpes keratitis treatment. Herpetic keratitis OS. Herpetic keratitis I. Herpetic keratitis drops. Herpetic keratitis virus. Herpetic keratitis ICD-10. Herpetic keratitis image. Herpetic keratitis orphan. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.